Today's complex healthcare environments demand that registered nurses quickly assess patient situations and make astute, sometimes split-second clinical care decisions. Welcome to the Clinical Simulation Learning Center in the Faculty of Nursing at the University of Calgary, where the use of simulation is a vital component of our nursing education programs. Within this center, scenarios that mimic clinical reality create the conditions for highly innovative and integrative learning experiences for students.
Okay, so if you could just put this around.
Learners are engaged and nursing knowledge and expertise are enhanced as students manage both expected and unexpected health events in their simulated patients.
I'm having a little bit of trouble breathing.
While not a replacement for actual clinical experiences with real patients, simulation provides a meaningful bridge between theory and practice without risk.
It's so close to the real thing. Our instructors design actual case scenarios where the simulators have physical and emotional responses.
It all adds to the realism of the situation. We have to intervene in real time.
The simulation essentially demands that we apply our knowledge, communication, and clinical reasoning skills.
These are the skills that we need to use as nursing professionals to bring about the best possible outcomes for our patients and their families.
Our state-of-the-art Simulation Learning Center houses 32 basic patient care environments and also includes 3 simulation suites, 3 control stations, and 3 debriefing rooms. All spaces are flexible and adaptable.
So, what was going on for Mrs. Smith?
We asked her to
Our high-fidelity simulators are a technologically sophisticated family of mannequins who are able to breathe, blink, and speak. Students can listen to heart and lung sounds and feel pulses. These amazing simulators are also capable of responding physiologically to medications and treatments.
I'll be okay. I'm a little worried that maybe I have a fever or something. I don't feel real good.
A trained faculty member operates the simulator from the control room, adjusting the mannequin's verbal responses as well as the timing and progression of the simulation event. These parameters change depending on the level of the student and the learning objectives. Believable makeup, props, personnel, and interactions are used to heighten the perception of reality by the learner.
Where are they causing you the most discomfort, Mrs. Rogers?
My back.
Noelle, our birthing simulator, provides the opportunity for students to care for a laboring mother and her newborn baby within a hospital setting.
Getting a good pulse rate there. It's quite quick.
In an instant, the room can be transformed so that the student arrives for a follow-up visit at the home of this same mother and her newborn.
So I've been a little worried because my baby is sleeping a lot during the day.
Okay, well, it's actually really normal for your baby to take long naps.
The home care suite is also designed to mimic conditions where care for seniors may be provided to ensure their safety in the home. A computerized electronic health record system containing simulated patient data files replicates those currently used in the hospital and community care environments. This innovation was achieved in collaboration with our local health region, allowing for a more seamless transition to actual practice settings. The Faculty of Nursing at the University of Calgary educates graduate as well as undergraduate students, and everyone uses the Clinical Simulation Learning Center.
How one copes when they are finally in the role of a fully responsible and accountable professional is highly visible to others, and it carries with it high expectations of performance, and in fact may influence one's chances for employment or advancement. So how we are able to prepare professionals to make the transition into the real world is critical to their future. As a researcher in the area of professional role transition for over a decade now, simulation for me is perhaps the most innovative and potentially impactful strategy that we have for addressing some of the disparities between what nursing students are taught and how they actually experience their first professional practice role as a nurse.
I've just begun to use simulation in my work with graduate students in the nurse practitioner program. It's a wonderful tool for their learning. Using realistic, complex, simulated scenarios, the students are afforded the opportunity to explore their clinical decision responses and further refine their case management skills in a safe environment. I see great potential for further exploration of simulation technology in the future.
The capacity for digital video capture is the hallmark of a simulation learning encounter. Scenario events can be recorded, and immediately following the simulation, an instructor-guided debrief using the video recording affords students dedicated time for reflection. In a supportive environment, students learn to openly give and receive feedback, rethink actions, reactions, and decisions, as well as review their errors, all which contribute to professional growth and development.
What were some of the things that were going through your mind at this time?
She had just come back from the operating room.
And practice that.
The center is also a hub of interprofessional practice and research, where teaching excellence is demanded, best practices are defined, and inquiry is encouraged.
High-fidelity simulation offers intriguing possibilities for educational researchers. The ability to place students in embodied, improvised performances of the skills they're acquiring, along with the capacity to record these episodes for analysis and interpretation, offers us powerful insights into teaching and learning.
Application of research outcomes is integral to the advancement of nursing knowledge and human health and wellness. The Clinical Simulation Learning Center invites professionals from numerous educational and healthcare organizations to collaboratively develop initiatives focusing on simulation and its contribution to nursing, medicine, and other disciplines.
The Clinical Simulation Learning Centre at the University of Calgary sets the stage for the next transformation of nursing education in Canada. In the Faculty of Nursing, we're proud to be innovators in teaching, learning, and research, and to be preparing outstanding clinicians and leaders for our healthcare system.